My name is Alex Enriquez. I talk about osteitis, fibrosa, cystica. Definition is a skeletal disorder resulting in a loss of bone mass, awakening of the bones as their calcified supporting structure are replaced with fibrous tissue and the formation of cyst-like brown tumors in and around the bone. Osteitis fibrosa cystica, abbreviated OFC, also known as osteotic fibrosa, osteodystrophia fibrosa.
Hello, this is Dr. Carlo Oger, emergency physician and founder of pediatricvideo.com. This video is about hypercalcemia, or high calcium levels in your blood. Hypercalcemia means that there is high level of calcium in the blood. The most common cause, 9 out of 10 times, is parathyroid gland that is too active. This is called hyperparathyroidism. The parathyroid glands are under the thyroid gland. They regulate calcium in your body. Other causes include medications like lithium and thiazide diuretics, which are water pills, also vitamin A, kidney problems, illness that cause bone to break down. This leads to extra calcium in the blood. Some cancers can make a hormone that releases calcium from the bones. Some cancers spread to the bone and cause the bone to break down. Symptoms of hypercalcemia include stones like kidney stones, bone pain, abdominal or belly pain, constipation, anorexia, which is loss of appetite, nausea or vomiting. Also heart problems like arrhythmias, brain problems like confusion, lethargy, or coma. It is safe for you to go home today. The high calcium level is not dangerous. The doctor may want you to take a medicine to lower your calcium. If so, you should take it as directed. It is very important you follow up with your doctor as soon as possible so he can test for the underlying causes of high calcium. Return to the emergency department immediately if you're feeling overly tired for no reason, you have belly pain, your muscles are weak, you have confusion or other symptoms that were not there when we first saw you. For
Applications in the medicine. If the hypercalcemia is mild, you and your doctor can choose to watch and wait and check your bones and kidneys. Over time, they will check on those who are still healthy. Medicine like calcitonin, calcimimetics, bisphosphonates, denosumab, prednisone. Extremely high calcium levels can be a medical emergency. You may need to be hospitalized to provide intravenous fluids and diuretics to lower your calcium level immediately and avoid problems with your heart rhythm or damage to nervous system.
So hypercalcemia, this is the big one, the most common paraneoplastic syndrome. And in hospitalized patients, the most common cause of high calcium is malignancy. Most commonly seen in breast cancer, lung cancer, and multiple myeloma. The symptoms you all are familiar with: fatigue, anorexia, abdominal pain, constipation, the whole moans, groans, mnemonic, polyuria, polydipsia, mental status changes, and potentially sudden death due to cardiac conduction disturbances. You may find evidence of renal dysfunction, EKG changes, and hyporeflexia involving the deep tendons. Rarely this can be a presenting sign in someone with malignancy, and occasionally may herald an occult cancer. And usually when you have hypercalcemia, your patient's in a tough spot, with life expectancy generally less than 6 months in most cases. So there are several medications that can be used for malignant hypercalcemia, and it's important to have familiarity with them. Bisphosphonates, such as zoledronic acid. Pimidronate was the sort of older version of that we used to use a lot of and now less. Steroids can be useful, particularly when you have hypercalcemia in lymphomas or other granulomatous type diseases associated with malignancy. And calcitonin, which can be given either once or twice daily, and this is sort of a quick fix over a couple of days to help bring the calcium levels down in severe cases. Remember, with calcitonin, you can get tachyphylaxis, and so after 3 or 4 doses, it may stop working, and so it's really a temporary short-term fix for hypercalcemia. But bisphosphonates is really the mainstay of your definitive therapy. Pimidronate and zoledronic acid. These medications have been used quite a bit in patients with skeletal metastasis, but now are also being used in malignant hypercalcemia. Zoledronic acid is now the drug of choice because it is more potent than pimidronate and has only a 15-minute infusion time as opposed to 2 to 4 hours with pimidronate. These drugs are well tolerated, but the big toxicity that you should be aware of is risk of osteonecrosis of the jaw, and this has emerged over the last 5 years or so. Thankfully, it's very rare, but it can be really bad if it happens, and these patients can really have trouble with exposed bone in the mandible, requiring debridements, repeated infections, and so prevention is the best treatment, and so we now mandate all our patients, with exceptions of emergent situations, that they get dental clearance prior to starting these drugs, because the biggest risk factor is needing dental extraction or other major dental work while you're on these drugs. So zoledronic acid, treatment of choice definitively for malignant hypercalcemia. So as in our test patient, what you want to do is volume expand them right away with isotonic saline to maintain a decent urine output. We used to say to always give diuretics. Now we don't do as much of that anymore. We can give them, but only after we've established a euvolemic state. And in that case, you would give furosemide, not a thiazide diuretic.
Pros and cons. Pros. Calcium is a mineral found mostly in the bones, where it accumulates and keeps them strong, contributes to the contraction of muscles, helps the nervous and brain function properly, helps regulate the heart rate and blood pressure. Too much calcium in the blood often does not cause health problems, but over time, some of the cause of excess calcium in the blood can result in osteoporosis. Cons: dehydration, weight loss, anorexia, asthenia, itching, gastrointestinal, nausea, vomiting, constipation, ileum, polyuria, polydipsia, muscular weakness, fatigue, confusion, hyporeflexia, psychosis, seizures, drown signs, coma, bradycardia, long period interval QT interval.
Hello viewers, today's topic is hypercalcemia or high levels of the calcium. The calcium is an important for the bone strength as well as the muscle and the nerve function. And the calcium levels in the bloodstream are regulated by the PTH. Vitamin D and calcitonin. The hypercalcemia can vary in severity and chronicity. And the main cause of the hypercalcemia is hyperparathyroidism. And the malignancies, which means the cancers, may be associated with the hypercalcemia, and the presence of hypercalcemia usually heralds a worse prognosis. Now, the signs and the symptoms of the hypercalcemia can be remembered by the phrase moans, stones, groans, bones. MSGB. It stands for moans, stones, groans, bones. So, the treatment and depends on the underlying cause of hypercalcemia as well as the degree of severity.
Issue applied in Ecuador. Osteitis fibrosa is a markedly rare disease occurring in only 2% of all patients diagnosed with primary hyperparathyroidism, which is the case for 90% of patients with osteitis fibrosa. Primary hyperparathyroidism is twice as common in individuals with diabetes.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 571, Rapid Review. What is Osteitis fibrosa cystica? Osteitis fibrosa cystica is a skeletal disorder caused by surplus of parathyroid hormone from an overactive parathyroid gland. What lab or diagnostic finding is observed with hyperparathyroidism or osteitis fibrosa cystica? In hyperparathyroidism or osteitis fibrosa cystica, you see brown tumors of the bone. This is not a true neoplasm, and the appearance of brown color is due to hemosiderin deposits from hemorrhages.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.
Conclusion. All CRC patients have some degree of secondary HPT at some point in their evolution. Despite the progress in the medical management of these patients, many continue to develop progressive bone disease and continue to have high levels of high PTH. Bone resorption is widespread and produce a diffuse decrease in bone mineral density, it with the hands being the earliest site of compromise.
A newly diagnosed patient with hypoparathyroidism typically is, as it would be for any disease, very concerned about what it means to have this disorder. Because of the ready access of the internet and information, most patients who come to us with this new diagnosis already know something about the disease, and it's negatively connotated. They hear about some of the long-term negative consequences of living with this disease, and frankly speaking, sometimes they're in a panic. So one of the first things that I do is to reassure them that we can control this disorder, we can regulate their blood calcium, we can't actually return them to their former state.
If a patient comes for the first time with a new diagnosis of hypoparathyroidism, there's a lot to be learned about the disease. So what I typically do is I explain just roughly what the disease is about and how to treat it. And then I see the patient at the beginning quite often to make sure that he or she understands the disease and how to treat it. And obviously, I also tell them about the Hypoparathyroid Association and the educational resources that are available on their webpage.
I talk to them about the symptoms of hypoparathyroidism and the symptoms really of hypocalcemia so they can understand and identify when their calcium levels may be low. And then we try to empower patients by allowing them to become familiar with the relationship between supplemental calcium, supplemental forms of activated vitamin D, and how they can use these medications to relieve some symptoms of hypocalcemia, and how they can participate with their own primary care provider in maintaining an optimal serum level of calcium while avoiding elevated urinary calcium levels. And that really is the key, balancing the serum calcium that will prevent symptoms of hypocalcemia against the urine calcium that, when excessive, can lead to an increased risk of kidney stones.